Is adamantinoma bone cancer only found in the tibia? Imagine a rare type of bone tumor that mostly appears in one specific part of the body but can sometimes show up elsewhere. That's what makes adamantinoma so interesting. It is a low-grade malignant bone tumor, which means it is a form of bone cancer that tends to grow slowly and is less aggressive than other types. Most often, it is found in the tibia, which is the shin bone. Specifically, it usually develops in the middle third of the front part of the tibia. Because of this, doctors often first suspect adamantinoma when they see a tumor in this area. However, it is important to know that adamantinoma is not only found in the tibia. While over 80% of cases occur there, it can develop in other bones too. Medical reports and clinical experience have documented cases where the tumor appears in bones like the fibula, which is the smaller bone next to the tibia, as well as in the upper arm bones like the humerus, the forearm bones such as the ulna and radius, and even in the thigh bone or femur. In rare situations, it has been found in bones like the ribs, pelvis, spine, wrist bones, and ankle bones. There are also very unusual cases where the tumor appears in the jawbone, hands, or feet. People of different ages can develop adamantinoma, but most cases are diagnosed in young adults. It tends to affect males slightly more often than females. Symptoms usually include a slow-growing swelling that might not cause pain at first. Over time, it can lead to bone deformity or even fractures because the tumor weakens the bone structure. Diagnosing adamantinoma involves imaging tests like X-rays, CT scans, or MRI scans to see the size and location of the tumor. A biopsy, which involves taking a small tissue sample, confirms whether it is adamantinoma. Since this tumor can come back even many years after treatment, ongoing follow-up with healthcare providers is very important. In summary, although the tibia is the most common site for adamantinoma, it is not the only bone where this tumor can develop. Recognizing that it can occur in other bones helps ensure accurate diagnosis and effective treatment. If you or someone you know has symptoms or imaging results that don't quite fit the usual pattern, doctors should consider the possibility of adamantinoma in other bones as well. Always consult healthcare professionals for personalized advice and proper management.